Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to look at Bartonellosis, a very common disease, a very debilitating disease that affects millions around the world and of which most people are not even aware of because, as we will see in the course of this presentation, it's quite tricky to detect and even trickier to treat successfully. Don't worry though, we have a lot of experience here at Christine.Doctor with treating Lyme and Bartonellosis, which is a very common co-infection of Lyme disease, naturally, holistically and successfully, and we're gonna show you how you can do that. We're gonna explore the symptoms, how you get infected with Bartonella, and everything else you need to know about it. So, without further ado, let's dive right into it. Bartonellosis is a problematic and often very debilitating disease. It usually appears as a Lyme co-infection together with Mycoplasma and Babesia, but it can be an infection vector on its own as well. When it attacks the central nervous system, it creates severe conditions such as MS, ALS, and autism. Infectious endocarditis is also caused by Bartonella. It's known as Carrion's disease or angiomatosis, and it is often misdiagnosed by the medical community. Bartonellosis is neither a rare nor a simple condition to treat, and Bartonella infections have been around for thousands and thousands of years, but the identification and characterization of Bartonella bacteria species started only about 20 years ago. When you go on PubMed, you will find thousands of peer-reviewed articles about Bartonellosis. Virtually every mammal harbors one or more Bartonella species that are transmissible by a blood-sucking arthropod vector such as flea, fly, lice. The CDC underestimates Bartonella infections by a factor of between 100 and 1,000. About 12 to 32 million people in the US alone develop infectious endocarditis, and out of those, 600,000 up to 9 million are infected with Bartonella. The situation is alarming not only in the USA, but also around the world. 3 to 6% of blood donors are infected with Bartonella, and thus considerable Bartonella-infected blood, amounts of Bartonella-infected blood is given in hospitals to healthy patients, and this leads to the huge numbers of 8 to 17 million Bartonella-infected people who are asymptomatic, so they don't even know that they have become infected. 25 to 40% of ticks are infected and are a vector for Bartonella and Borrelia infections, and this corresponds to several million newly infected people in the US alone. We know so far of 19 Bartonella strains that can and do infect us humans. What is Bartonella then? Let's find out. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to spread the truth and help this channel grow. For the holistic natural care you need and deserve, do not hesitate to contact us at Christine.Doctor. We have decades of experience with treating Lyme disease and Bartonella successfully in a natural, holistic way. And also check out some of the most powerful holistic health tools at vibrantbody.net, Links are also in the description box below. And by the way, until the end of the year and only as long as supplies last, we still have an amazing sales action going on at vibrantbody.net on 4 truly powerful holistic health tools. You can save hundreds of dollars and we ship them to you for free anywhere in the world. So take advantage. Alright then, what is Bartonella? It is a gram-harmful bacteria of the Proteobacteria group. Interestingly enough, alpha Proteobacteria, to which Bartonella belongs, include also Ehrlichia, Anaplasma, Rickettsia, and Rocky Mountain spotted fever, which are all Lyme co-infections. These group members share virulence and resistance that is due to their double-walled structure. All members of this alpha Proteobacteria phylum share DNA between themselves and their hosts to secure their proliferation. And this synergy means that you get sicker by the day and the therapy also becomes more difficult by the day. Bartonella is very resistant to all types of antibiotics and it uses 3 mechanisms to defend itself against antibiotics. First, it has this double cell wall structure. Then it also uses a particular group of enzymes called beta-lactamases, which deactivate beta-lactam antibiotics. On top of that, it uses a variety of multi-drug efflux pumps to pump away the antibiotics. And they also know how to metabolize the antibiotics and transform them into food that they can use. Bartonella is fastidious, aerobic, slow-growing, pleomorphic, non-motile, non-spore-forming, and chemotropic. They are choosy with what they eat. They like oxygen and they take 24 hours to reproduce. And they have variations in their sizes and shapes, do not have flagella and they cannot propel themselves. They love to live in the blood and intracellularly, so inside of our cells. And they're very tiny, only about 2 to 5 microns long and 0.2 to 0.5 microns wide. They can enter our bodies through a variety of mechanisms, such as bites, scratches by animals, and insects that like to suck our blood, such as lice, ticks, fleas, and we can also ingest them. Many ticks carry Bartonella species, such as Ixodes, Dermancetor, Rhipicephalus, and Hemaphysalis. Biting flies also have Bartonella in them, such as Lepoptina, Hippobosca, and Melophagus. And the Bartonella undergoes many genetic changes in order to adapt to its environment and to the host-specific conditions. Every 5 days, the Bartonella releases new bacteria into our bloodstream to keep the red blood cells infected. Here we have a list of different Bartonella species, their primary hosts, the accidental hosts, and the diseases they can cause in us humans. For example, Bartonella bovis has cattle as its primary host, as the name already suggests, and dogs, cats, deer, and eggs as accidental hosts. And it does not cause diseases in us humans, but if you go through the list, you notice that most of the Bartonella species do indeed cause severe diseases in us humans, such as endocarditis, myocarditis, joint pain, mental confusion, seizures, neurologic diseases, fevers, anemia, etc., etc. So most of them, unfortunately, are quite dangerous. As you can see from this list, Bartonellosis can cause a whole range of very severe symptoms, such as unexplained fevers, cold extremities, seizures, severe rage, rashes, hot flashes, anxiety and panic attacks, muscle twitches and tremors, brain inflammations, memory loss, spinal cord inflammations, blurred vision, liver disorders, enlarged spleen, behavioral changes, and the list goes on, and as you notice, most of the symptoms are quite severe. While the Borrelia breaks down the collagen, Bartonella attacks the endothelial cells, especially those that line the blood vessels. Bartonella also spreads throughout the lymph system and colonizes the bone marrow, and uncontrolled growth in the endothelial cells creates different types of hyperplasia and angiomatosis, which is the growth of epithelial cells in the blood vessels. Many people with Lyme or Bartonella infections are misdiagnosed with lymphoma because, as you can see from the pictures, it can cause very swollen lymph nodes. Factors that affect the Bartonellosis symptoms are the type of strain of Bartonella, the constitutional weakness of the patient before the infection, the immune system health of the patient, and whether the patient suffers already from other chronic infections and conditions such as Lyme, cirrhosis, COVID, etc., etc. And then also the nature of the inoculation vector matters. Bartonella bacilliformis is specific to South America. It produces profound anemia, which can even lead to death. And if death does not occur, people experience blood-filled warts on the body, which is a kind of angiomatosis. Bartonella as a Lyme co-infection is much harder to treat. The symptoms are more severe and inflammations are more pronounced, and also the cytokine cascade is more complex. Bartonella will attack the weakest parts of your body first. If you work with toxic chemicals, for example, Bartonella will prefer to locate in the liver. If you suffer from chronic stress because of your work or your life situation, the Bartonella will prefer to go into the large joints. Bartonella has a microparasitic strategy, a protozoa strategy, to establish a persistent infection of the host, and the virulence of Bartonella depends on the following. The subversion of the host cells with effector molecules delivered via the type IV secretion system, inductions of pathological angiogenesis, including apoptosis and activation of hypoxia-inducing factor, the use of afimbrial adhesins like Yersinia, the incorporation of lipopolysaccharides with low endotoxic potency in the outer membrane, and there are other virulence factors that help Bartonella persist in the endothelial cells and the erythrocytes. The infection of the central nervous system leads to many cognitive problems as well as neurodegenerative diseases. Infection in the hippocampus, for example, causes memory problems, unexplained rage, homicidal attacks and spatial disorientation. Condition of the cerebral cortex cause problems with memory, attention capacity, perceptual awareness, use of language, and clarity of thought. If they go into the hypothalamus, this causes issues with the body temperature, so you feel very cold all the time. It also generates hunger impulses, increases fatigue, and interrupts the sleep cycles. It can cause encephalitis as well as meningitis, Also MS-like symptoms like tingling in the limbs and severe pain. An infection of the skin leads to non-healing skin ulcers that show tumor-like proliferation of blood vessels. And similar lesions may also be internal on various organs, but they can most often be found on the skin surface. The primary target of the Bartonella are our red blood cells because they need heme from our blood to survive. And therefore, they begin seeding new bacteria into our bloodstream every 4 to 8 days, simultaneously from all Bartonella colonies in our body. And this is how the Bartonella is spread throughout our bloodstream. Studies have shown that every new Bartonella generation is genetically slightly different each time. This is known as pleomorphism. And the Bartonella uses this strategy to confuse our immune system, to great success, unfortunately. 10 to 14 days post-infection, the bacteria enter the different endothelial locations, and PCR testing techniques can unfortunately not identify the Bartonella in the blood. Our red blood cells cannot engulf other cells, and thus the Bartonella has another trick up its sleeve. It has a deforming compound that opens up a pore in the blood cell through which the bacteria can then enter the blood cell, and once it gets into our red blood cell, it forms a vacuole to protect itself and starts replicating. But their intelligent strategy doesn't end there. The Bartonella also limits the number of bacteria to just 8 per blood cell. And it does this in order not to burst the cell. When they enter the red blood cells in a higher number, it is to snap the Bartonella into the bloodstream intentionally and to colonize other sites. About 2.5 million red blood cells are produced in our bone marrow per second. We have about 25 to 30 trillion red blood cells, also known as erythrocytes, and they live for about 120 days, so 4 months, before they are being replaced. And when they finish their life cycle, the erythrocytes are redirected to our spleen, liver and bone marrow for recycling. And of course, these sites are preferred by the Bartonella, which develops its colonies in the endothelial lining of our liver, spleen and bone marrow preferentially. Hemoglobin is being oxidized with PMNs, which stands for polymorphonuclear leukocytes or polymorphonuclear neutrophils, to methemoglobin, which is an altered form of hemoglobin with an extra iron ion, so 3 iron ions instead of 2. And this pathway creates many of the Bartonellosis symptoms. Usually we have about 1 to 2% methemoglobin in our blood, but with Bartonella this amount gets much higher, and this creates symptoms such as anxiety, headaches, dyspnea on exertion, fatigue, confusion, dizziness, tachypnea, palpitations, seizures, and arrhythmia. Extracellularly living Bartonella is moving heme from site to site, which is yet another way that this bacteria uses to colonize our bodies. So the Bartonella prefers to invade the 4 body parts. They have this preference for our endothelial tissue, and they find this in the lymph nodes, the spleen, the liver, and the bone marrow. The Bartonella forms in these parts of our body body granulomas, And granulomas are effective forms of the cellular vacuoles the Bartonella bacteria create in the endothelial tissue to invade the organism and the organs. And these granulomas are primarily found in the liver, spleen, the lymph nodes, and the bone marrow, of course. Granulomas contain Bartonella, CD4 plus T cells, so lymphocytes, and monocytes derived from CD11b plus, as well as epithelial and endothelial cells. The granulomas in the spleen and liver are dangerous and have the potential to create ruptures of the organs, known as microabscesses. Typical symptoms of hepatosplenic involvement are fever, abdominal pain, weight loss, chills, headaches, and myalgia. In the lymph nodes, the Bartonella is located in the endothelial cells of the blood cells, and the macrophages lining the sinuses, as well as the local germinal centers and non-necrotic areas of inflammation. Some Bartonella, like the strain known as Hensley, produces severe swelling of the lymph nodes, and additionally there might come also suppuration and necrosis. These granulomas can also be found in the bone marrow, showing numerous small abscesses or nodules that can be widely spread in the bones. And therefore, bone pain is one of the primary indications of Bartonella infections. The granulomas in the bone marrow are epithelioid with a distinct donut ring shape. And you can see the infections here of the bone marrow in the liver and the spleen in the pictures on the right. Alright then, let's see how we can holistically and naturally, and most importantly of course successfully, treat this very tricky infection. As we have learned, the Bartonella are antibiotic resistant, so we cannot use antibiotics, but there is a strategy that we have developed over the years and that is really successful. We first of all protect the endothelial cells, then we try to protect the red blood cells, and then we also must interrupt the cytokine cascade, so the inflammation. Each individual infected with Bartonella will present slightly different symptoms. Thus, you will always have to apply the core protocol followed by specific therapy protocols for the particular symptoms of the patient. For severely infected people, the protocol can be 12 to 18 months and has to be adjusted every 2 to 3 months. You can heal Bartonella completely, but the symptoms may sometimes be quite severe and even unbearable. You might be bound to a wheelchair, you might have psycho attacks and severe pain. Some of the infected people are asymptomatic carriers, and the symptoms will intensify with the immune system deterioration and the aging process. In our Bartonellosis core protocol, we target the following. We want to reduce the cytokine cascade that is triggered by the Bartonella. Then we protect and normalize the red blood cells. We also look out for the safety of the heart and blood vessels. We protect and normalize the endothelial cells, and also the spleen, liver, bone marrow, and lymphatic system. Then we boost the immune system also. And the most efficient approach has turned out not to be with antibacterial herbs, but with herbs that have multiple actions on the cytokine cascade, the endothelial and the red blood cells, and which also have a protective action of the mentioned organs, and other multipotent herbs. And for your customized Bartonella care protocol, do not hesitate to contact us at christine.doctor. Link, as mentioned, is in the description box below. We have decades of experience with this insidious bacteria and Lyme disease in general, and we can definitely help you out. Here you see some of the natural remedies and supplements we use in our proprietary Bartonella core protocol. When it comes to natural remedies, we love to use the herbaceocytokine stop, the organ regulator, the immune booster, and the Bartonella antibacterial preparation. And as far as supplements go, we recommend L-arginine for its endothelial activities at 2000 to 4000 milligrams per day, NAC at 4000 milligrams per day, EGCG with quercetin, vitamin E, pomegranate juice, luteolin, olive oil, ginkgo, royal jelly, zeolite, 15 drops 4 times per day, as well as shiitake mushrooms. So those are the natural remedies and supplements we recommend as a standard care procedure. But as we've mentioned, we also have to adjust the therapy to the specific symptoms of the patient. And depending on the symptoms, we also use herbaceous improvement, the anxiety stop, the sleep well, the fatigue fight, the herbaceous dry cough stop, and also the herbaceous anemia well, amongst other natural remedies. As you can see, Bartonella infections, also known as Bartonellosis, are quite insidious and quite tricky to treat, but if you have the experience, as we do at christine.doctor, it can be done successfully, even though it takes time. Please, again, contact us at christine.doctor. We will take care of you. Also, do not forget to take advantage of our sales action at vibrantbody.net and get 4 amazing holistic health tools for a significantly reduced price, plus free worldwide shipping until the end of the year only, and only as long as supplies last. Link, of course, also in the description box below. If you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is also down below. And do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. With all that being said, I hope that you've enjoyed this presentation, and until next time, stay healthy.